This is Urban Health Today, and I'm speaking with Dr. Erin Dickman, a nursing doctorate and clinical program specialist at ImpediMed. She's here to discuss oncology nurses and their role in breast cancer survivorship care with a focus on lymphedema management. Thanks for being here today, Erin.
Thank you so much for having me.
I appreciate you talking to me today. All right, let's get started. Please talk about your background and your work as an oncology nurse with ImpediMed.
Yeah, absolutely. So I have 15 years of experience as an oncology nurse. I was lucky to get my calling to become an oncology nurse during a clinical rotation where I was taking care of blood and marrow transplant patients. So it really showed me the art and the heart of nursing. So the art being that science, right? We're critically thinking, we're problem solving for the patient, ensuring they get the best care, but also that heart, right? You're connecting with the patients, you're taking care of them and their caregivers, and just guiding them through a very vulnerable, scary time in their life. And so I found that I also was very interested in taking care of my colleagues, these nurses that work so hard that need to be cared for. And so I ended up in leadership, really focusing on the well being of staff. And I got involved in our local Oncology Nursing Society chapter and found myself really being drawn to this profession and making a difference. And so prior to coming to ImpediMed last fall, I was working for the Oncology Nursing Society for 7 years. So this is the professional home for oncology nurses. We build education and clinical practice guidelines and standards of care to support oncology nursing and advanced cancer care around the country. And then I heard about this wonderful technology that ImpediMed has that really protects quality of life for cancer patients by detecting lymphedema early when you have the opportunity to reverse this awful side effect of cancer treatment. And so, in my role currently, I have the pleasure of leading interprofessional teams in implementing evidence based lymphedema surveillance programs using our technology.
You worked for the Oncology Nursing Society, and then ImpediMed basically recruited you and said, "Hey, we've got this great product." And can you talk a little bit about the product?
Absolutely. So the SOZO device uses bioimpedance spectroscopy technology, which sends 256 low electrical currents throughout the body and measures fluid changes. And so it can detect as little as 2.4 tablespoons of fluid shift. So these patients who have that are at risk for lymphedema aren't feeling any changes in their limbs, but we can know as clinicians, we can be confident in saying you have these early signs that your lymphatic system isn't working quite right, and we're going to treat this early so we can reverse those side effects. I love preventative medicine. I love evidence-based practice because around this technology, right, needs to be a program built. There needs to be interprofessional collaboration. There needs to be education to the patient. There needs to be the surveillance model of care where we consistently test this patient and educate them and get assessment findings along with this SOZO device using bioimpedance spectroscopy to get an LDEX score. So this is an objective measurement, one that has a validated scale, so we can, again, be confident that even though we're not seeing physical signs, that lymphedema is on the rise and we should treat it early.
What is survivorship care? What does that look like?
Yeah, so the National Cancer Institute defines survivorship care as this period from cancer diagnosis through the rest of a person's life, and it focuses on their overall health and well-being. This encompasses long-term side effects and monitoring for late effects. And so those two terms I might use a couple times. So for
Sure.
those listening, long-term effects are those side effects that occur during cancer treatment, but cancer treatment's over and you still have that condition. So this could be fatigue or cognitive dysfunction or cardiotoxicity or lymphedema. And then those late effects are those ones that could happen years after your cancer treatment's over, but we still know that there's a possibility that you could get them. And so we still need to surveil and monitor for those so you can have a high quality of life. And so again, survivorship looks at this whole person and what they might need to really transition back into their daily lives and have that balance and well-being.
Hmm. So I know that National Nurses Week recently wrapped up, but this is also Oncology Nursing Month. How has the role of oncology nurses evolved beyond treatment to become central in breast cancer survivorship care?
Yeah, absolutely. So survivorship care is not a one size fits all. It really does need to be tailored to the patient and it takes a team. But oncology nurses are often that consistent thread throughout a survivor's experience, helping them move from surviving to truly living again. And so traditionally, nurses have deeply been involved in the treatment aspect. So giving the chemotherapy, the radiation therapy, managing those side effects. And survivorship care has really just become an extension of that critical role that nurses play in care. And so today, many nurses are actually leading or co-leading survivorship clinics. Um, and then they are providing that supportive preventative care. They also are important at just bridging that communication gap in between all the different interprofessional team members that are caring for that patient, ensuring that the care is clustered. Maybe a patient needs to see multiple specialists. And so knowing that a patient maybe lives farther, right? It takes into consideration that person's home life, not just their breast cancer, like who they are as a person. And then oncology nurses are often the ones that provide and talk about and give the patient their survivorship care plan. And so these are documents that are specifically made for a patient that includes their history of treatment, any kind of side effects they might have, any long-term or late effects that they might be managing or looking for, that risk for recurrence, additional screening that they need to do to ensure that if there were a recurrence or a secondary cancer, that they catch it early. It might talk about health promotion and certain things that the patient needs to do to continue a healthy lifestyle. And so again, the nurse plays a key role in educating the patient about that plan moving forward and transitioning to other care that might be provided maybe by their primary care provider, but ensuring that they're really capturing that patient and what they need, again, to live that balanced life.
At what point is the patient handed over from the oncologist, the physician, or the surgeon to the onc nurse?
Oh, to the oncology. Oh, so we all work together as a team.
Okay.
And so I think where there could be some handoff to like a survivorship team,
Hmm.
which a lot, because of some of new clinical practice guidelines and because of the evidence of how we know how great survivorship care is for our cancer patients, we actually are seeing that these survivorship clinics come. Again, this for this holistic care for these cancer patients that are living a different life than they had before they had cancer. And so this happens at different times. There's a lot of variable practice when it comes to this. And my hopes in the next decade is that it becomes more standard of care and that all of our cancer survivors get that same consistent ongoing support. But it really just depends on the different breast program that you're in team that's caring for you.
Oh, okay. So it's not a standardized handoff. Okay. It just
Not
kind of,
yet. Yeah,
okay.
not yet.
That makes sense. Breast cancer survivors are expected to be part of the 22 million cancer survivors by 2030. What professional challenges do you see in providing them support?
Yeah, so the American Cancer Society says that there's 4 million breast cancer patients living today. So that includes cancer patients that were just diagnosed and being treated, some that have lived years being treated for breast cancer. It's become almost like a chronic condition. And then lastly, those patients that are not getting active, or those people that aren't getting active treatment. And actually, the 20-year survivor rate for breast cancer is 71%. So there's a lot of people out there that have maybe even lived decades with in remission from breast cancer. So to I think it's important to know a little bit more about the survivorship population too. So, and the incidence of breast cancer. So, the incidence of breast cancer is actually increasing every year by 1%. And then in patients under or people under 50, it's increasing at a faster rate. We're seeing 1.4% of people under 50 getting breast cancer. And so, our survivor group is getting younger. And so, those younger populations have different needs, and we have to take those into consideration when we tailor their survivorship plans and we care for them. They might have to have hard conversations with kids that are still going to school, that still live in their house. They might not have been going through menopause yet, and they have fertility wishes and hopes. So again, kind of knowing your population is so important and giving them tailored support. And so I think sometimes the challenges that we see with that is obviously the changing population. And then we're also grappling with a national nursing shortage, which puts a strain on care delivery. So there's a real risk for burnout among nurses who are being asked to do more with fewer resources, although patients are living longer and requiring more complex long-term support. We also face challenges in care coordination, especially when systems are fragmented. Survivors often see multiple providers without strong nursing leadership and survivorship care. Important pieces can fall through the cracks, from mental health support to surveillance for late effects like lymphedema. And then new evidence and advanced technologies like bioimpedance spectroscopy are often lead to better patient outcomes, but it takes about 17 years for evidence-based practice to get implemented into practice, which is a very long time. And so I really think to meet the needs of this growing survivor population, we need to invest in nurse training. We need those interprofessional models of care, and then we need policies that support sustainability of this workforce. I mean, it is an exciting time to be an oncology nurse, but it's also a critical moment to rethink how we support both survivors and the professionals who care for them.
I also think you need more nurses because the nurse shortage is right on the horizon with a large number of nurses are going to be retiring. So what is lymphedema, since we're talking about it? What is it and why does it remain an overlooked in survivorship planning despite affecting 82% of patients?
Yeah, so the lymphatic system is great, right? It helps us aid in digestion, but more importantly, it helps our immune system. So um, it fights bacteria, infections, and so certain cancer treatments, so breast cancer treatments, can result in the damage or the removal of lymph nodes. So surgery, right? You sometimes remove lymph nodes, and then you have radiation to that area that could damage. And so lymphedema ends up being a buildup of fluid. So your lymphatic system can't drain that fluid, and that can lead to swelling, discomfort, limited range of motion, increased risk for infection. And really, lymphedema may arise soon after cancer treatment or develop years, months afterwards. Patients that have a risk for lymphedema have that risk for their lifetime. And so most often lymphedema develops slowly and progresses over months or years, which is why a surveillance program works so well, right? You can catch it in its earliest phases before you have any of those side effects. Unfortunately, the reason why I think it's not included in survivorship care plans and is underdiagnosed and undertreated is because it is that late effect, right? You really have to have a program and a pathway to keep in contact with your patients that aren't being treated any longer and really educate them on why it's important to adhere to a surveillance program so that they come back for those tests years down the line because they're still at risk. And so I think one of the reasons is, again, that late effect of when a patient might start having signs and symptoms of lymphedema. And then the second is some clinicians just don't know about lymphedema or know that you can catch it early and reverse it. Some people don't know about this technology. And so then they can't share with their patients of what to look for with lymphedema so that they can catch it early. And then they don't understand that there's an opportunity for surveillance models. I think another reason is that the workforce is just stretched thin, right? Comprehensive follow-up for late side effects like lymphedema can fall through the cracks, go to the wayside. So I think those are some of the reasons why we don't see it sometimes in survivorship care.
Hmm. I gotta tell you, so I have a friend. She's a 2-year survivor. She had
Yeah.
a lumpectomy a couple of years ago, and she had it in, actually she had it in, yeah, in 2023. And it feels to me like since she had the surgery, it was like almost right away, right after the surgery, she'd been complaining about lymphedema, and all she talks about is how much pain she's in, how it's just so painful and she's just so uncomfortable all the time. And it just seems to be like a constant refrain. And here we are almost 2 years down the road, and she still talks about how much pain she's in from the
It,
lymphedema.
yeah, it's absolutely devastating. Like beyond just the physical effects, there's a lot of emotional kind of effects of having lymphedema, right? It can be distressing. It can be a reminder of your cancer. Your clothes fit differently, right? You're trying to every day fit into this new body that you're not used to, and still do things you love. And it just causes a lot of stress.
Hmm. So beyond the physical symptoms, what emotional and financial impact does lymphedema have on breast cancer survivors?
Yeah. So on top of kind of what we were talking about of that just person adjusting to this new body that no longer feels or functions the same, a lot of patients report body image concerns and a loss of confidence, especially again when swelling interferes with clothing or activities. They become hypervigilant about, maybe it's going to get worse and stressed. That leads them to choose to not go to certain events or things with their friends, right? If they think that um, that swelling might be noticed, or maybe they have limitations in their ability to do something now. And then it's also a financial burden. So it costs a lot of money to manage lymphedema. So you have compression garments that you need to wear, maybe certain custom fit devices, manual lymph drainage, physical therapy appointments. And so that's for if again, lymphedema becomes chronic, it's not reversed, you have to manage it for the rest of your life. And so sometimes that can lead to delayed care or possibly patients deciding that they don't want to receive certain types of care. And so it's really important as an oncology nurse, right, that we advocate not just for symptom control, but comprehensive support. So connecting them with financial resources and emotional support and referrals to maybe mental health, because we know that survivorship is about more than survival. It's about helping patients live fully and comfortably after cancer.
So you talked about bioimpedance spectroscopy. Why does it, or BIS, why does BIS represent a significant advancement in lymphedema care?
Yeah, so bioimpedance spectroscopy or BIS, again, is a non-invasive technology that measures that fluid, right? So we can see that slight change in fluid shift to that extracellular space. And it's really a game changer because it's that ability to confidently identify lymphedema in its earliest subclinical stages where it's reversible. And it shifts this surveillance model to a preventative model versus reactive. So traditionally, lymphedema was diagnosed after visible swelling or a change in your arm volume,
Mhm.
at which point it's harder to manage and often becomes a lifelong condition. But with BIS, clinicians can detect fluid accumulation early and intervene proactively, and just with simple strategies, right? So at home compression, maybe some physical therapy, some site massage before the condition progresses. So it empowers clinicians to really personalize care and protect quality of life for cancer survivors. And it's really a quick, painless, easy to use in clinical settings and backed by evidence. Incorporating it into standard follow-up protocols could drastically reduce the burden of lymphedema on both patients and the healthcare system.
How are oncology nurses uniquely positioned to champion early lymphedema detection compared to other healthcare providers?
Yeah, throughout the cancer care continuum, nurses build strong, trusting relationships with patients. They're deeply attuned to their baseline functioning and subtle changes over time. So, pairing those assessment skills with tools like this put them in a perfect position for early detection. Nurses are also natural educators and advocates, so we can teach patients what signs to look for, empower patients to report symptoms early, and help navigate access to lymphedema resources. Nurses often coordinate care across disciplines, so we're critical in making sure lymphedema doesn't fall through the cracks. And in a system where lymphedema is still under-recognized, nurses can elevate it as part of survivorship care, advocating for routine screening protocols, early intervention strategies, and insurance coverage. Ultimately, our close connection with patients combined with our clinical expertise makes us ideal leaders in detecting lymphedema.
So, going back to my friend, you talked about early detection and the importance of early detection. Now, if
Mhm.
it's detected too late, or it's detected later on after the swelling and after the pain, um, is it harder to, I know you said it becomes chronic, but is it
Mhm.
harder to treat the lymphedema when you catch it later?
Yeah, and it depends on the person, right? Like we're all a little bit different,
Mhm.
but there are usually a need for more extensive support and management. And it's just because the lymphatic system has become even more inflamed, depending on when you catch it, the inflammation and the certain adipose tissue buildup and like the thickening of skin, like some of those things could get worse if not treated as soon as possible.
So, what specific differences have you observed in patient outcomes when it's detected and managed early?
Yeah, so early detection and intervention in lymphedema make a profound difference in patient outcomes, physically, emotionally, functionally. So when we catch lymphedema in its subclinical or early stages, before there's that visible swelling, interventions are typically less intensive and more effective. For instance, patients might only need education like compression garments or simple exercises. And this leads to reduced progression to chronic lymphedema. One of the most noticeable benefits is in that mobility and function. Patients who begin management early are much more likely to maintain full use of their arm and hand without limitations. Emotionally, early detection leads to a sense of control and empowerment. Patients feel more confident and less anxious because they're actively being monitored for lymphedema, and they often report better quality of life and lower emotional distress. From a healthcare perspective, early intervention also reduces the burden of care. It decreases the need for that complex treatment, urgent visits, or hospitalizations due to infections. And so overall, the difference is really night and day. Patients with early intervention tend to have better physical outcomes, less psychological strain, and significantly improved long-term quality of life.
So, in your opinion, in your professional opinion, do you think that it would behoove oncology teams to always have lymphedema top of mind as part of the continuum of care?
Absolutely. I mean, especially with breast cancer programs with 82% of patients at risk, even with low risk, it doesn't mean no risk. And so ensuring that education is done and following evidence-based practices with lymphedema surveillance, absolutely. Um, because of that late effect, right? It's so
Mhm.
important to keep bringing up this topic because it can happen years down the line, and you want that patient to know confidently what to do, or like we were saying, like so they know that they're being monitored, right? They can live day to day, not being so anxious or stressed that it might one day pop up, or that could be something that they have to deal with.
What training do oncology nurses need to effectively implement lymphedema monitoring programs in their practice settings?
Yeah, so nurses need really a comprehensive training to effectively support lymphedema surveillance, which should include, what is the lymphatic system? What is the pathophysiology of lymphedema? What do I need to look for on assessment? What do I need to ask my patients if they're experiencing? They need to know how to use technologies like this. They should be trained about how to educate the patient, maybe risk reduction strategies. And then it's important to really understand that surveillance model, right? Why is my patient coming back years later after treatment so that they can confidently educate the patient that, yes, it's still important that you come back for us to monitor this. We really need to have them trained to collaborate with the interprofessional team to make appropriate referrals. And then finally, nurses need to learn how to evaluate these programs effectively so that they can ensure it's truly improving patient outcomes.
What does the recent endorsement of BIS technology by organizations like the NCCN and NAPBC mean for nurse clinical practice?
Yeah, so with BIS now included in the National Comprehensive Cancer Network survivorship guidelines and the National Accreditation Program for Breast Centers Accreditation Standards, oncology nurses are really encouraged to use it in routine screenings to detect lymphedema early. It gives them confidence in educating patients on the benefits of BIS, advocating for its use, and promoting early intervention. The guidelines also highlight the importance of interprofessional approaches, so it enables nurses to really collaborate with other healthcare professions on lymphedema surveillance. And really, as BIS becomes a standard of care, nurses can further advocate for necessary resources and funding to ensure its availability in practice.
So this is not something that has to be recommended by the physician or the surgeon. The nurse can step in and say, look, my patient needs this, and then it would be made available if it's within the healthcare systems within their means.
So usually it does start with a provider, a surgeon's, or an advanced practice provider order. There are some systems that have nurse-driven protocols.
Mhm.
So they do allow that nurse to initiate this type of surveillance, but every program is different. That variable practice that gets us every time. But usually it is a provider that starts this initiation of wanting this test.
Is it even on their radar though? I mean, what role do oncology nurses have in educating other oncology providers about this technology?
It is a team. Absolutely. I feel like nurses absolutely have a say and advocate every day for additional resources and care and accessibility to new technologies and evidence-based practice. And so I think this is absolutely, um, there's an ability for oncology nurses to really champion this and get access for their patients in their breast cancer programs. For nurses love evidence-based practice. We will do anything for our patients. We listen to them, and we will get them what they need. So absolutely, once they are aware and know about this and know it's best practice, I think they are great advocates and champions.
Yeah, I agree with that. I just wonder if if doctors and surgeons if those things, because they seem to be more focused on, okay, I've excised the cancer and my job is done. So I'm just trying to envision how that
Right.
right.
And that's why we have that team, right? Like all those people have like the specific roles, and absolutely the nurse is there looking at that whole person and caring for that whole person and getting them the care they need. Or, if they can't give them the care, referring to the professional, the nutritionist, the smoking cessation program, and connecting and building those bridges. And so, a lot of surgeons educate their patients about lymphedema and care deeply about their surveillance programs.
Oh no, I'm
And the
sorry.
nurse,
I'm not implying that they
no,
don't.
no, no, but the nurse is such a great reminder because
Okay.
everyone on that team gets busy. And so it's that additional quality check of like, have we cared for this whole person today and into the future? And so again, the nurse is just that important person that does build those connections, provides those reminders, those gentle, nice, reminders, so that the care team is giving the patient what they need.
How do you see the nurse's role in survivorship care evolving over the next decade, including conditions like lymphedema?
Yeah, so I see the nurse's role in survivorship care evolving significantly over the next decade, especially as survivorship becomes recognized as its own critical aspect of cancer care. So, not just what happens after treatment, but this active, ongoing process of healing and support. So, I see nurses, especially maybe those nurse practitioners and clinical nurse specialists, playing increasingly autonomous roles and
Mhm.
leading survivorship clinics and managing follow-up care with a focus on that prevention and surveillance and quality of life. They'll be essential in that early detection efforts using technologies like this and monitoring for conditions like lymphedema and those late side effects. Nurses will start educating patients with more personalized attention. They'll shift from this general information and share more precision health coaching. They'll tailor guidance based on individual risk factors to prevent complications before they arise. Additionally, nurses will have a growing influence, I think, in shaping policy around getting access to this care for patients,
Mm.
refining institutional protocols, and driving research and innovative change in things like lymphedema prevention to address those disparities in post-treatment care. So, in short, nurses will shift from being supporters in survivorship care to being strategic leaders and primary providers and innovators. And at the end of the day, it's about giving survivors the chance to live fully without fear, without delay, and with the compassionate, proactive care they deserve.
If I could just circle back to the emotional impact of breast cancer survivorship, I wanted to ask you, um, at what point do you have group support for patients? Like what kind of mental health um, therapy do you recommend for, or do you recommend them for? Is that part of the care continuum when it's needed?
Absolutely. Unfortunately, again, it's variable depending on different programs, but I find that support groups are such a powerful tool for programs to connect these people with these same lived experiences and these same barriers to transitioning back to these normal lives. And so I think that is really wonderful. A lot of times, different programs do have therapists that are able for referral and different members of the team that are trained in supporting the mental and emotional aspects of care. And so I urge everyone to know those paths and be able to use those screening tools. So NCCN has a great distress screening tool that allows the clinicians to understand when a patient might need support. And then specifically for lymphedema, there's other quality of life, certain screening tools. So, like for instance, your friend, I would hope that her team would start giving that to her, asking specific questions to understand if lymphedema is affecting her quality of life, and then starting to make changes and supporting her based on those findings so that her emotional and well-being is cared for as well.
Yeah, I think she's getting massage therapy, but it doesn't sound like it's helping very much.
Mhm.
I think it's just helping. But again, it goes back to what you were talking about with the late effect where it wasn't found early enough. And so she's sort of going through it. And it's not as bad as it was initially because of the massage, but it's not great.
Right. So hopefully, there are certified lymphedema therapists that she can get connected with that can monitor and manage her lymphedema care. And so there's a lot more interventions that they can do to support her. So if massage isn't working, hopefully a nurse or someone on the team will advocate for her, but maybe she also needs to advocate for herself to get connected to those, experts in lymphedema because um, yeah, if it's not working, we got to try something else.
Yeah.
Gotta make it feel better, right? I don't want you to be in pain
Yeah.
every day or feel uncomfortable. That is absolutely, as a nurse, I'm like, no, we got to figure it out. We have
Yeah.
to
Yeah.
find
I
you a
think she's just kind
solution.
of living with it.
Oh,
Yeah.
advocate. Nope. Just, yeah, keep trying new things.
I'll pass on the word. I'll tell her. You got to advocate, girl.
Advocate, yes. But well, and it's hard for survivors, right? Because
Yeah.
they're like, well, they already helped me survive. But really, it's so much more. We want more so people come in, they don't want to complain. But it's not complaining. It is living that full life. We want you to live that balanced life, healthy life after we've gotten rid of the cancer.
Yeah. Yeah. Well, I'll pass that on to her. Dr.
Yeah.
Erin Dickman, thank you so much again for your time today.
Yeah, it's been a pleasure. Thank you so much for having me.